In a perfect world, your neck would look something like this when you walk or run. A nice, healthy shock absorber system bouncing and gliding smoothly with a nice, healthy forward arch. This is what we hope to improve in your neck. Have thinning of these little cushions in here. If the cushions are thinned and you have calcium deposits and bone spurs, your spine is already compromised. And so you want to be even more careful and more gentle with how you handle and manage your spine. All the techniques that we use are designed to be safe and gentle first and foremost. And even somebody with advanced degenerative arthritis can safely be treated to improve the segmental movement that they have and to minimize irritation of the areas that are already locked. Okay, so that's where having proper x-ray analysis, sometimes an MRI, to check the degree of calcium deposit. Something called stenosis you'll hear about. Stenosis is basically a crowding of the nerves. In between these little holes right here, they're called the intervertebral foramen. It's just the little holes, little tunnels, where the nerves branch off your spinal cord and they come out. When those nerves get compromised, when they get crowded, when there isn't much wiggle room, that irritates the nerves and causes the muscles to tighten up. So first and foremost, we have to figure out the safest, most gentle way to improve what link movement you have safely and gently. If you have stenosis, we can still do this very safely and gently, and it's very effective if you do it correctly. If you have a herniated disc in your spine, in your neck, we can do decompression therapy. That's kind of like a fancy rack. It's in our room too, and it's a computer-based device that you lie down and it cradles your neck, and we set the computer setting on a certain poundage, and it very carefully, very slowly pulls your spine apart. So it's traction, it's kind of like a rack, and then it very slowly, very carefully starts to let it off the pressure again. So that's why we call it decompression. It's different than the old kind of traction in that it's not just pulling it apart. The new therapy is designed, the new technology is designed to pull it apart and then ramp down the tension, and then pull it apart and ramp down the tension. That's why they've classified the new technology, the new technique, as a decompression. So you hear a lot of doctors advertising decompression. Can be very effective. You have to be a candidate for it. If your disc is so weak and the disc is actually herniated or fragmented into the nerve canal, sometimes we have to refer you to the neurosurgeon. And if that's necessary, I will do that. If, however, you can safely manage conservatively these types of conditions, and especially if we can figure out everyday postures or activities that you might be doing that might be adding to your problem, we'll start there first. We want to give you the best solutions, starting with the simplest ones first, those that you have control of, that are free. All you have to do often is modify how you do things at home. A lot of people get well simply doing that, and if they can get well doing that, wonderful. I'd like to help you discover how to do that. If it does require a type of rehabilitation or a training of the spine to move better, then we'll look at that option as well. Okay? So back to the sheet. When you have osteoporosis, now osteoporosis is a loss of bone density. If you have brittle bones and you have extreme osteoporosis, there is a weakness and a settling effect that can set in. Now, when you look at the neck and the upper back, which we're going to talk about in the thoracic spine video, typically what happens is with osteoporosis is the body of the bones will settle. I hate to use the word collapse, but it's a form of collapse. It's a settling a little bit. So what used to have a rectangle shape to it actually becomes slightly wedged. So if you have a 10 or 15% wedging at each individual bone in here, and you add that up over multiple segments, it causes the spine to round off. So that's why people who have osteoporosis, you see what's called a Dowinger's hump, where they get this rounding off right here. So there's a way that we can manage that, but the best approach for that is to keep it from happening in the first place. So we want to start there. So if somebody's in their 20s or 30s, they should be already thinking about these things, because preventing things is much more effective than waiting until you have a full-blown problem and then trying to play catch-up later. An ounce of prevention when it comes to the spine is worth 10 pounds of cure. So our goal is to be safe first and foremost. When you have osteoporosis, we talk about various options available to you to improve bone density. Some of the more common pharmaceutical approaches would be drugs like Fosamax, Actonel, and those have their place. However, if a person has a way of safely boosting the bone density of the bone matrix without side effects, then I like to look at those options first. My favorite type of way of boosting bone density is using an oral spray because the absorption is so great when it comes to oral sprays. Comparing different types of oral absorptions, if you take a pill or a capsule, a calcium, magnesium type pill or capsule, you might get 15 or 20% absorption. If you do a sublingual, it's a little bit better under your tongue. If you do a patch on the skin, that's also pretty good. Again, maybe 40 or 50% absorption. When, however, you do an intramuscular injection, where you inject something into a muscle, the absorption goes up, way up to about 90%. The only thing that beats an intramuscular injection is an oral spray. Now, there's a handout that we have on oral sprays. This was a study published in the physician's desk reference. So this isn't something that we're making up. It's not something that some vitamin salesman made up. It's not something that some doctor of chiropractic made up. It's something that's been done by reputable medical groups. And the published information, which we can give you a copy of, says that oral sprays are absorbed about 95%. Now, I've seen results with oral sprays firsthand because I've had multiple, they just happen to all be women who have been doing bone density tests, multiple bone density tests, all of whom had tried various forms of pharmaceutical approaches to boost bone density. One of those including Fosamax, Actonel. Basically, these were women who were not getting any results at all. They kept going back to their doctor who was doing bone density tests. As a last resort, I said, hey, have you considered oral sprays? They would begin doing oral sprays. 6 months later, 9 months later, they would go back to their doctor. They would do another bone density test, and the doctor would go, whoa, what are you doing? There's something better that you're doing. Suddenly you're getting good bone absorption, calcium absorption in your bones, and it's actually causing better and increased density. And once we began getting those reports back, I began to realize that this isn't just a fluke. This is for real. Oral sprays work. And I have before and after, pre and post bone density tests to show multiple people that have had improved bone density of the bone matrix using oral sprays, something called osteocalmag. So that's a very, very good approach when it comes to boosting bone density in your spine, whether it's your neck or anywhere else. Herniated discs, first you have to get them properly diagnosed. If you have a bulging disc or a herniated disc, then you have to figure out a strategy or a care plan to stabilize that. So it starts with x-rays, MRI scan to confirm or rule out herniated disc. I do refer to neurosurgeons, spine surgeons, orthopedic surgeons when surgery is necessary and indicated, especially if conservative care has failed over a reasonable period of time, which we can talk about what reasonable may mean. Reasonable for me might mean 8 to 12 weeks of conservative therapy. Because there's such a high success rate, you want to try all conservative options first before going to surgery, only as a last result. But when surgery is necessary, it can work beautifully if need be, and safely. I've had a lot of people over 25 years who have needed to have surgery on their spine and their neck, and when they end up needing that, we have a lot of good spine surgeons we can refer you to.
The morning finds me here.